Wait a minute. Okay, slides. Ishan, please start.
All right. Very good evening to everyone. You hear, you might remember. You see, you might remember better. You do both, you'll never forget. Welcome to our weekly series of the SCOMedics Monolgues, brought to you by SCOM at MSAI. MSAI, that is Medical Students Association of India, has 6 standing committees. SCOM, that is Standing Committee on Medical Education. SCORA, that is Standing Committee on Sexual and Reproductive Health. SCORP, that is Standing Committee on Human Rights and Peace. SCOPE, that is Standing Committee on Professional Exchange. SCORE, that is Standing Committee on Research Exchange. And SCOP, that is the Standing Committee on Public Health. SCOM is a Standing Committee on Medical Education, working extensively on shaping the quality of medical education, in turning, upgrading qualities of future physicians and improving the standards of healthcare. Through our joint efforts, we work to create sustainable changes in our country for ourselves as medicos and for the generations to come who are in fact the beneficiaries of education. Students convene in SCOM to share and learn about medical education in order to improve it as well as benefit the most from it on a personal and professional basis. The SCOMedics Monolgues is one such initiative by SCOM to bring the best faculty the country has in various fields of medicine to share and impart their knowledge through a series of free live webinars and lectures to the students at MSAI, free of cost. I now hand over to Chinmay, our General Secretary, who will introduce our distinguished lecturer today.
Hello everyone, on behalf of Medical Students Association of India and Executive Board, I would like to invite you all to today's first lecture in SCOMED, our new lecture series. Before I introduce about the lecture series and talking about like how we'll be going through it for the different lectures this year, I would like to ask Shashi to give us some idea about SCORA. This is Standing Committee of Reproductive Health and AIDS. Shashi.
Good evening, everyone. My name is Shashi Bhushan, and I'm the National Officer for Sexual and Reproductive Health, including HIV/AIDS. Talking about SCORA, it is about gathering individuals who are committed to promote sexual and reproductive health and rights and are passionate in creating positive change in our local community. We have 5 focus areas: comprehensive sexual education, maternal health and access to safe abortion, sexuality and gender identity, gender-based violence, HIV and other STIs. Over the last year, we have done many national events, which include a nationwide survey during the World Breastfeeding Week, PRISM, an online campaign for LGBT rights, awareness campaign for breast cancer and testicular cancer, and infographics during the World AIDS Day. All the events have been really successful and have got tremendous response from the audience globally. And right now, we are getting up to start with the comprehensive sexual education for school-going children. Today's webinar on menstrual cycle and hormone regulation is a very crucial topic in obstetrics. A good understanding of this topic can be very beneficial not only for medical students, but for everyone to help them know about the physiology of pregnancy and thus improve the maternal health care. Now I would like to call Dr. Chinmay Jani, Vice President and General Secretary of MSCI, to take over and introduce our lecturer.
Uh, Once again, welcome you all. So for regarding our lecture series, we at MSCI try to bring something new to you. By this initiative, we want to bring different professors, the best professors of medical field from different parts of India. Today we are starting with obstetrics and gynecology lecture, the basic reproductive physiology lecture with Dr. Sushma Shah. Dr. Sushma Shah is currently professor of obstetrics and gynecology in NHL Medical College of Ahmedabad and V.S Hospital. I'm sorry for a few technical glitches. I'm sorry for a few technical glitches. Without wasting much of the time and ma'am's time, so I'm just introducing her. She is professor of obstetrics and gynecology in NHL Medical College of Ahmedabad, and she has been working as professor since last 19 years and teaching undergrads and postgraduate students. So hope so you all will take this opportunity to learn in different kinds of different fields today in physiology of reproductive health. And if you have any questions, you can ask on live chat, and ma'am will try to answer you. And even after the session gets over, you can send your questions. Thank you. I will hand over mic and hand over the class to ma'am. Thank you.
Hello guys, very good evening. Wish you a very happy evening and a happy beginning to this new venture of MSCI. Thank you all to MSCI and SCOMedics for inviting me for this lecture. And believe me, it's a joy to be connected with you, to people all over India. So today, we are going to start with the ultra basics of reproduction, and that is going to be the first introduction to the menstrual cycle. So, well, I just believe that we are interacting. Please put in your doubts and questions as and when they arise. I will try to solve them either during the lecture if possible or at the end of it. Now, menstrual cycle, as we all know, or maybe most of you know by now, is the cyclical shedding of the endometrium, which happens every month in a woman of reproductive age. Now, what do we understand as reproductive age? The woman of the active reproductive age is supposed to be between 15 and 45 years of age, but then extends to 12 and it can go up to 50 or 52. So basically at 12 or 15 when the reproductive function starts, we call it the menarche, and when the reproductive function wanes and begins, when we call it the menopause. Well, so what happens before 12 or 15 years of age? Before the 12 or 15 years of age, when the young girl is growing, the reproductive system is in a state of sleep or in a state of inactivity, because the human body at this point of time is not ready for procreation or for reproduction. As the human body matures, so does the reproductive system, and once the body itself is ready for reproduction, there is a beginning of the menstrual cycle. So basically, the cyclical shedding of the endometrium, which is visible externally as a discharge of blood monthly, is called the reproductive cycle or the menstrual cycle. Now, basically, the average length of the menstrual cycle is 28 days. But as we all know, the human body does not go according to fixed standards. So, 28 days plus minus 7 days would be a normal range for a reproductive cycle. Meaning that reproductive cycle, or if a girl has her periods every 21 days on a regular basis, that is normal for her. If a girl has a menstrual period every 35 days, is regularly on a regular basis, that again is normal for her. But if it keeps fluctuating at 20, 24, 22, 23, 35, then it is definitely not within the limits of the normal cycle. This is not a normal cycle. Right, so that is all about normal cycle. Now, I just hope you all can recollect your basic functional anatomy. Let's just have a quick recap. So, I hope you remember all of this, but just a brief schematic diagram. This is the uterus, where most of the things happen. These two are the fallopian tubes, which are like the two appendages of the uterus, and to that is attached an ovary on either side. Right? So, the uterus itself is a reproductive hollow muscular bag. The fallopian tubes are the conducting tubes for the ovum, and the ova are the reproductive cells present in the ovum. As we all know, every month after the onset of menarche, one ovum matures and is released from each ovary alternatingly from one side. So if it is the left ovary which is ovulating today, it is going to be the right ovary ovulating the next day. Now, this uterus has a cavity which is called the endometrial cavity, and this cavity has an inner lining which is called the endometrium. Now, this endometrium has a very special nature. It is in a constant state of flux, or it is a very dynamic endometrium. It undergoes cyclical changes, and it responds to the various sex hormones produced by the ovary. So basically, what are the functions of the ovary? The ovary has two main functions. One is production of the egg or the oocyte, and two, it is the hormonal function. What are the chief main hormones of the ovary are the estrogen and the progesterone. There are of course the other hormones, the paracrine and the other peptides which are secreted, but these two are the main players of the ovary. Now, to understand the endometrial cycle, now this endometrium is very receptive or very susceptible to the changes in the estrogen and progesterone. So, if we see the endometrial cycle, if it is a 28-day cycle, an average endometrial cycle is a 28-day cycle. The first day of the cycle being the first day of the menstrual period. That is the day when she starts bleeding, is considered traditionally to be the first day of the menstrual cycle. So, if on this chart, if these are the days, day 1 is the first day of the cycle, day 40 in a 28-day cycle would be the ovulation, and day 28-day cycle. So, day 1 to 14 is called the proliferative phase. 14 to 28 is called the secretory phase. Now, the first 5 to 7 days are the days of shedding of the endometrium. During this time, the total endometrium is shed along with the accompanying blood, the lymphocytes, the neutrophils and all, and at the same time there is a simultaneous regeneration of the endometrium. So, in one place in the endometrial cavity, if there is shedding of the endometrium from the right lateral wall, the left lateral wall is now undergoing regeneration. So by day 7, the first day 7 of the endometrial cycle, the entire endometrium is shed and the entire endometrium is regenerated. Now, if you look at the basic histology of the endometrium, it is consisting of, it could be understood as 3 main zones. One is the basal lamina, which is the lamina propria. 2 is the stratum spongiosum, and the third Now the endometrium has to be studied in its three different components. One is its lining epithelium or the cells. Two is the stroma. And three is the glands. These three components respond to the various hormonal influences, and that is how the endometrium grows. So, in the beginning, that is on the day 3 or 4, it is just a 1 to 2 millimeters endometrium, which then gradually grows. So, there is a growth of the epithelial cells, there is active mitosis, and a basal epithelium, which is a single line columnar epithelium, continuously regenerates and keep growing upwards and forms a multi-layered columnar epithelium. The stroma initially is sparse, gradually increases and fills up with glycosaminoglycans and the connective tissue with some elastin and some fibrin fibers. Now the glands are a very important element of the endometrium. These glands continuously secrete secretions which are very, very important to the nourishment of the embryo and maintenance of the moistness of this epithelium. So, at the onset, the basal epithelium has the basal part of the glands here. As this epithelium grows under the proliferative phase, the cells grow and form a multi-layered stratified epithelium, all formed from the columnar or cuboidal cells. These glands also undergo, grow, and go up to the stroma. And the stroma consists of the connective tissue matrix and blood vessels, which are the spiral vessels of the endometrium. So, that is how it is. Now, during the proliferative phase, what happens in the ovary? In the ovary, there is the starting of the formation of the Graafian follicle. The ovary consists of, can we have those pictures? So, this is the ovarian cycle. Is it visible? Okay. No, that's not the one. Okay. Is this visible to everybody?
No, it's not visible. You'll have to remove everything. You'll have to remove the thing.
Okay. Let's do this.
Just a minute, we are making few changes in mic system. So just for a minute. This is right. This you can keep now.
In this question.
Yeah. Try.
Hello? 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 Yeah, so if you can have a look at the blackboard. This is the Graafian follicle. These are the various stages in the development of the Graafian follicle. This being the first, the primordial follicle. Here is the oocyte and a single layer of cuboidal epithelium, which then gradually develops into a multi-layered epithelium under the effect of the FSH of the pituitary. This is now called the primary follicle. The oocyte being the main reproductive cell of the female. There is a development of a perivitelline membrane and the multi-layered granulosa cells. These primordial cells are now called the granulosa cells. The stromal cells of the ovarian cortex in the periphery of the granulosa cells now differentiate, and now they are called the theca cells.
These theca and granulosa cells together are the main organisms.
They are the main apparatus for the secretion of the ovarian steroids, the primary being the estrogen and the progesterone. This primary follicle then goes on to develop into the antral follicle. Here, there is a development of a cavity under the influence of secretions. This is the primary oocyte. The granulosa cells, and because of the accumulation of the secretion, there is a formation of the cavity, and now this is called the antral follicle. This antral follicle is now also called the Graafian follicle. It is about 1 centimeter at day 7 to day 9, which then grows on to 1.8 centimeters to 2 centimeters at the time of ovulation. At the time of ovulation, under the effect of the sudden LH rise, the hormonal influences we will be discussing in the next lecture. Under the effect of the sudden hormonal surge of the LH, which is also called the LH surge, there is the expulsion of the ovum from the Graafian follicle into the peritoneal cavity, which is picked up by the fimbria of the fallopian tubes. This is a very significant event in the ovarian cycle, and this event is called the ovulation. In the absence of ovulation, we do not see any regular menstrual activity, neither do we see the regular reproduction. That is, these females tend to have irregular cycles. They may suffer from amenorrhea, and they have a problem in conception. Now, after the expulsion of the ovum, this Graafian follicle is now called the corpus luteum. So, it collapses because of the loss of fluid. The follicle, as well as its surrounding Graafian granulosa cells, is expelled, and this complex is called the cumulus oophorus, and this remaining apparatus is now called the corpus luteum. The main secretory hormone of the corpus luteum now is progesterone in a greater amount and estrogen in smaller amount. Before ovulation, the main hormone of the corpus luteum of the Graafian follicle is estrogen, lesser amounts being progesterone. There are other hormones or the endocrine secretions, also called inhibin, activins, and the others, which are regulatory necessary for the regulation, the endocrine regulation of the internal ovarian milieu. So this is ovulation, which in a normal 28-day cycle takes place on day 14. And after the ovulation, the Graafian follicle primarily secretes progesterone, which is the main hormone of pregnancy. Progestation. The hormone which favors gestation, is called progesterone. In the absence of any other stimulus from HCG, this corpus luteum continues to function for another 10 days in the absence of the HCG signal from the developing blastocyst. If there is HCG, this corpus luteum will continue to function and secrete more and more amounts of progesterone. In the absence of the HCG signal, it undergoes atresia. There is increased fibrosis, increased deposition of lipids, and then now it is called corpus albicans. And gradually, the levels of progesterone fall and the low levels of estrogen also fall. So this is what happens in the ovary. Now, when all this is happening in the ovary, let's take a look. How does the uterine endometrial lining respond to the ovary? Well, if you see, this is the ovarian cycle. Here, there is a development of the primordial follicle. This is the preantral follicle with its cumulus. Here, there is ovulation, and this is the formation of the corpus luteum. Now, here in the endometrium, the first 5 to 7 days is the menstrual period with increasing thickness of the endometrium. This is day 14. This is ovulation. There is gradually increasing thickness of the endometrium, which goes up to about 4 to 5 millimeters in thickness. At the time of ovulation, there is a period of 24 to 48 days, which is sometimes also called the interval period. After that 48 days, it then becomes a secretory endometrium, which is called the secretory phase. This being called the proliferative phase. And now it is the secretory phase. So during the proliferative phase, there is increased multiplication of the endometrial lining cells. There is formation of the matrix, and there is increased formation and development of the glands. So there is formation of the glands, but mind you, the glands do not start secreting as of now. These are the glands. This is the increasing thickness of the endometrium, and this endometrium is developing its own vascular supply. Under the effect of this estrogen, all this activity बेटा मारो चालू कर ने जुई so far so good.
Yeah, very good.
Be realistic, Julie.
Nah, good.
Problem is technical much.
Shivan, you're connected. I was tomorrow.
જે આપણે ઓફર છીએ ને
અરે બંધ થઈ ચાલુ છે હજી કોઈ